Perfect. Well, our numbers are starting to even out a little bit, so we're going to go ahead and get started. Thank you so much for joining us today for our webinar, Healing from Within, Somatic Practices for Your Mind and Body. My name is Jackie Zimmerman. I'm the Manager of Public Education, Partnerships, and E-Learning at Mental Health America's National Office, and I'll be helping to moderate today's session. I have just a few notes for everyone before I introduce our speaker. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, we have a form that you can fill out and complete. I'll post the link to that in the chat here shortly, and that will also come in your follow-up email. As many of you know, May is Mental Health Awareness Month, and so MHA will be providing lots of resources and ways for you to engage with us throughout the month of May, just like we're all doing here today. Information about Mental Health Month can be found in our toolkit and at mhanational.org/May. That will be another link I'll post in the chat so y'all can explore that later today and throughout the month of May to share. Without further ado, I'm joined here today by Amy Falchuk. Amy is a private practice and on faculty at the Institute of Core Energetics. She is currently a Master's of Divinity student at Naropa University. Amy graduated with a Master of Public Health from Columbia University's Mailman School of Public Health and a Master of Education in Counseling and Psychology from Cambridge College. Amy is a graduate of the Institute of Core Energetics, where she received an advanced certification in core energetics, a spiritual and somatic body approach to healing and transformation. Amy completed her postmaster's clinical training at Brigham and Women's Hospital in Boston, Massachusetts, where she worked on a mindfulness and exposure therapy study for patients with atrial fibrillation. She currently serves on the board of directors of Mental Health America, and her lectures can be viewed on YouTube and her writings on the Wellness Platform Goop. Amy, we're so thrilled to have you joining us here today for this really wonderful topic that a lot are curious about and a lot want to learn from. So I will hand it over to you to kind of take us through this next hour together. And just note to everyone joining, feel free to ask your questions in the chat. We'll be collecting those and we might have some time with Amy at the end.
Well, thank you, Jackie, and thank you to Mental Health America for including somatic body-based practices in Mental Health Awareness Month, because we are a body, we have a body, and that body is a resource and a source of healing. It also is a source of where our trauma may live, and so it can be a double-edged sword in that sense. But I'm really grateful to have been invited to do this. It's sort of interesting because those who know me know that I'm a fairly almost disembodied person. So I tend to live up in my head. I tend to do well with verbalizing and language and thinking and connection to spirit. And where I feel a little bit more challenged in my life is my relationship to my feeling body, my sensory body, my feeling body. And so for me, it's been a healing practice in itself to become a somatic therapist. And so my intention for this hour is to give you a little bit of background in terms of how I got to become a core energetics practitioner, to share with you a little bit about what body psychotherapy is, like what are somatic practices in mental health and well-being, and then take you through an experience where you can have a little bit of a taste of the ways in which we work with the body in core energetics. So, Jackie, on behalf of everyone that I can't see, does that sound like a plan? That sounds good?
Yes, that sounds perfect. Thank you, Amy.
All right, perfect. So, when people ask me, when clients ask me or potential clients ask me why the body is important in terms of healing and mental well-being, what I often say is we are first and foremost a body with a nervous system. And that nervous system is designed to do two things. One, keep us safe and alive. And the other is to engage us in the world. Right? So we have a deep desire to survive, and we also have a deep desire to thrive and to self-express. And so there's a way in which our body is already geared towards flourishing and living. Having said that, life happens. And oftentimes when we experience trauma, whether it's developmental or non-developmental trauma, the first hit is the body. So oftentimes, particularly when we're young, we don't have the sort of brain maturity to understand or conceptualize trauma. And so our body takes that first hit of that traumatic experience. We experience it as some kind of sensory overload in the body, right? So you can imagine sort of just walking into a room and you hear a sound, the first thing you're going to do is go, right? Your body's going to have a reaction. Then the thought comes, which says, maybe there's a threat here and I should do something. Or maybe your mind says, oh, that sound always happens when I open the door. There's nothing to be afraid of. And then the body goes back to a relaxed state. So in my work, the theory is that our traumatic experiences and sometimes just life, which can frustrate us, causes us to have physical bodily reactions over and over and over and over again, to the point where the body starts to contract to protect itself from further pain. So if you're scared a lot, right, and you're in this place of, and the threat of what you're scared of keeps happening, you're going to eventually almost stay in that position of a holding or a holding of the breath. And then off you go in the world as if that's just the way to be. And so sometimes clients will show up and say, you know, I have headaches all the time, or I feel tense all the time. And they don't have the recognition that they're walking around in that fear posture, right? So that's a long way of saying the reason why we focus on the body is because our traumatic experiences live in the physical body.
Yeah,
And so
absolutely.
to heal trauma in some way, or to integrate or to resolve to some extent, if we're able, we need to take a bottom-up approach just as much as we need to take a top-down one. So our mind and our thoughts are important and of value, but they're often a secondary experience to the primary experience, which is in the body.
Yeah. Yeah.
That's the first piece of why the body. The second thing is that if we think of our existence as being filled with just life force energy, like we feel expansive, we feel like we want to learn, we want to go towards relationships, right? If trauma is being held in the body and it contracts that energy, our life force is not flowing. And without that flow, there can be places of lack of motivation, there can be social anxiety, there can be perfectionism, there can be stubbornness. These are all sort of temperamental or personality traits, but they're also often signs of trauma. It's a defense pattern that keeps us safe. But what that does is it contracts the life force energy to not be in full flow. And when we're not in flow, we're not capable of all we're capable in life, including love and pleasure and curiosity and all the really wonderful things that life can bring. So that's another reason why we work with the body, is to free itself from the ways in which we protect ourselves from pain, essentially, from emotional pain mostly. And the third reason I would say that we focus on the body is because a lot of us, and I'm going to speak only for myself, I should say, a lot of my suffering and a lot of my anxiety comes from a place that doesn't want to feel my feelings. I would rather solve my problems through thinking it through or solving it mentally. And there's a way that I don't want to feel something because those feelings maybe feel scary, or I feel like it'll be like an abyss. I'll never get out of it, right? But those feelings live in my physical body. So in my mind, I can tell myself, I don't want to feel. I will keep myself from feeling by thinking this through or acting on something and trying to fix it. But when I slow down and come into my physical body, the feelings can't help but come. And that release, that discharge of energy, as we call it in core energetics, is a way to create one healing and integration, but also literally more physical space in the body,
Yeah.
right?
Yeah.
I
That
always
makes
use
total sense.
I always use the really horrible, I mean, a horrible example, and yet I keep using it. So I don't know what that means, but I always say to people, like, if you ate bad shrimp and you had this horrific stomach ache, right? And you're like, no, I'll be fine. I'm just gonna hold on to this and wait it out. Like, you wouldn't make that decision. You would try to get that shrimp out of your
Right.
body, right? And so again, odd example, but the idea is that our history, our feelings are frozen in the physical body. And that if we can thaw them out, if we can release them, if we can discharge them from the body, there's more for us to learn and there's more space for us to live.
Yeah.
Okay.
Yeah.
So I just want to check in. Is there anything that's emerging in the chat that feels like it needs to get addressed?
I think everyone's right here with you. A lot of comments of, having the same experiences either with themselves or with clients or people they're working with, of that fear of feeling, that fear
Yes.
of processing and over processing in your mind. Even just personally, I've gone through that, and I'm someone like you had mentioned where I have these tension headaches and chronic migraines and all of these things. And for a while, I was getting tests done on my GI
Yeah.
system of all these, really intense pains in my body. And all of it ended up coming back to my anxiety. And
Yes.
that was the root cause of all of these really physical pains.
Yes.
And so it manifests throughout your gut, throughout your muscles, throughout your whole system.
Absolutely.
And like you said, we want to process through it in our heads, and that's just one part of the healing.
Absolutely. And, it's always really important to validate for someone if they're having physical symptoms to make sure that there's nothing
Yeah,
medical going on.
exactly.
And if you've done that, and if you feel like you either understand it better or in the clear, you could begin to explore the idea of in what way is this chronic tension, or in what way is this gut issue, or in what way is my sleep issue related to some kind of holding of feeling,
Right. Yeah.
you know.
Yeah.
Um, I remember in my clinical training, I was an observer with one of the clinicians and who is a medical doctor. And this client came in and reported that they had just ended a relationship with their partner. And they kept putting their hand on their chest and they
Mm,
kept saying, it just hurts right here. And the young doctor said they were going to order an EKG. And I thought to myself, okay, it's a teaching hospital. That kind of makes sense. But my first thought was, she's heartbroken,
mm-hmm.
right? I mean, her heart is broken. And so while it may have been important to make sure her heart was physically okay, the opportunity was for her to, place her hand on her heart and just allow herself to feel the heartbreak and to
Yeah.
have someone be there with her in that. Right? So that's a really simple way that we go from the thought into the body where the feeling lives.
Right. Right.
You know, some of us get scared as practitioners to do who aren't trained in somatic practices that there's a lot you need to know. And yes, of course, ethically, there's a lot you need to know about the body, but sometimes it's just following your own impulses and intuition about what's happening for this person on a sensory and physical and emotional level more than the mental,
Yeah. Definitely.
right?
Definitely.
So, what I wanted to do, if this feels right, it's hard because I can't see folks, but is just um, introduce you to two concepts that we work with in core energetics, which are foundational, which may support all of you out there in your own personal work, um, or in your professional work. And the first thing is something that's often very familiar for people is the concept of grounding, right? So to be grounded is to be here, is to be present, right? To be grounded is to be in contact with reality. To be grounded is to feel attuned to yourself and one another, right? To be grounded is to feel like I can hold myself up in this world. I can stand on my own 2 feet, right? I can feel contact with the ground. I'm rooted. I'm connected, right? I very rarely feel grounded, partly because I live up here where it's safe, right? So if the energy goes up, we're here and stuff can happen here, but we're not connected to the ground, right? We can often feel uprooted in a political cycle. We can feel uprooted during a pandemic. We can feel uprooted when we have to go for a job interview, when we have to meet with someone, or when we do anything can sort of pull us away from contact with the ground. So in order to do our healing work, in order to feel like we can make progress in healing our trauma, as an example, we kind of have to be here to do that. And so grounding exercises, presencing exercises are a big piece of core energetics work. And so we can ground through lots of ways. We can ground through the feet. We can ground with the eyes. We can ground with our hands. We can ground with our mouth, right? We can ground with sound. And so one of the things that we do in a core energetic setting or session is, if it feels right for the client and it feels culturally appropriate, is to just hold eye contact and to just notice what happens, right? Often some of us feel even more uprooted when we make eye contact because it's intimate. And sometimes it can be the way where someone really is able to land in the room and feel safer or safe, right? Another way we ground is to put tennis balls under our feet and to roll back and forth on a tennis ball so that our feet sort of feel the pressure and of the ball pushing into it, and we feel more connection with the ground. Another way might be through touch. And so one can touch their own hand, right? One can just hold on to their own hand, or if it's appropriate in your sessions, to hold hands with the practitioner, right? And to just ground and attune. And so grounding is a really important aspect of any kind of somatic practice. And grounding is something you can do alone or you can do with others, right? So that's one concept. The other is something called containment. Now that word's outside of core, might sound like I'm saying contain yourself, don't feel. It's sort of the opposite, right? Containment is the ability to tolerate our own energy without needing to shut it down or act it out. So what do I mean by that? So if I'm having a lot of feelings or I'm having a lot of sensation in my body and I feel like the container, which is my body, can't hold it, I'm going to do one of two things. I'm either going to numb it out, I'm going to eat sugar, or I'm going to watch TV, or I'm going to take a pill, or I'm going to have like something to make the feeling just go away. Or I'm going to do the opposite and be aggressive or impulsive. I'm going to do something to throw the energy off. And so I often use road rage as a good example, where it's like you got all this feeling in your body and you can't contain it. And so you throw it off by screaming at someone who has cut you off. Both of those signify a lack of containment, meaning that it's hard for us to just tolerate the charge of our own life force. And so a lot of the things we do in core energetics is help clients build their physical container to be able to hold more energy in their body, whether that energy is pleasure or pain or anger or laughter, whatever it may be, or your sexual energy. Like, we need a container big enough to hold how big we really can be, right? And so in my clinical training, when I worked with patients with AFib, one of the reasons they were in the study is because they had a fear of their heart racing. And so a lot of them were engaging in avoidance behaviors. They weren't going out, they weren't socializing, they were taking pills, they were doing anything to sort of keep their heart rate down. So one of the things that we did was get their heart rate up. We'd have them sort of run up and down stairs. We'd spin them around in a chair. We might have them breathe heavily into a straw and then sit there and learn to tolerate the sensation of their heart beating and to just name, I'm afraid, I'm scared, I don't like this, I want my heart rate to lessen. And the more they could tolerate that increase in heart rate, the less afraid they were of increasing their heart rate.
Yeah.
And so it allowed them to learn how to contain the sensation of their heartbeat and the feelings associated with that so that they didn't have to live an avoidant life. So that's just an example, again, another example of, exposing the body to that feeling we're so afraid of and seeing that we can survive it so
Yeah,
that we don't have to
definitely.
live in fear of it.
Yeah, I love that. That's a great example. I know some people are posting in the chat different things that they've done too, which is great. Thank you all for sharing.
Yeah, I
A
wish I
couple,
could read them all.
yeah, a couple questions that have just come up about this that I think would be helpful.
Yeah.
Um, Someone asked, containment sounds like emotional regulation. Is that another way to say containment, or are these two different things you're talking about?
That's a really great question and very intuitive. And yes, I would say that if we think about it from a trauma-informed approach, when we are dysregulated, we are out of our own window of tolerance, right? So we're either sort of hyper-aroused or hypo-aroused or in a freeze state. And in part, it is because our system can't hold the energy of those feelings, right? And so in some ways, containment is emotional regulation,
Yeah.
right? It's our ability to tolerate the bigness of the feelings or the shutdown. It's learning to stay in it so that we can work through it.
Yeah.
So I very much, yes, we don't call it emotional regulation, but in essence it is.
Yeah. Yeah. That's
Thank you.
wonderful.
That's a great question.
Yeah. Thank you all for your comments and questions in here. I'm loving them. Coming through, I know there's some questions about breath work and meditation, and is that a part of this? And I'll let you continue because I know we have a lot more to continue sharing.
Yeah, no, those are all good questions. And I would say one of the most prevalent ways in which we armor through the body, and armoring in core energetics means that we block feeling and we block sensation. And again, we do that because we want to be safe. Like we never want to judge or criticize our defenses because they're there to keep us alive and safe.
Hmm.
But at some point, they may no longer serve us. So it just feels really important to remember that. But one of the most prevalent ways we armor is by holding the breath. So one of the first things I'll notice in a client, or frankly myself, is that they're not breathing. I mean, they're breathing enough to be alive, right? But most people's breath, maybe for those sort of out there, which again, I wish I could see you, like just notice in this moment, like where your breath begins and where your breath ends. So most of us breathe, I would say, maybe down here, but most of us sort of have a really short breath. And it's as much air as we need to function, but it's also not enough air, not enough breath to be able to really feel. And that's the design of sort of armoring in the breath, is that we hold our breath so that either A, we're ready for the fight, because again, if we think about being in a fear state, it's like, I got to be ready, can't breathe, I got to be ready for the fight. Or we don't breathe because if I really let myself breathe, I might have to feel something that feels very painful, right?
Wow.
Whether it's grief or longing or anger, right? Whatever it may be, right? So breath work is essential in terms of creating or eliciting feeling. If we don't breathe, we don't feel.
Yeah.
So if you don't want to feel something, the best way you'll go about doing it is to make sure you don't breathe, right? On the flip side of it, or not really the flip side. It's like breath work can also move us into a parasympathetic state, meaning that it can help relax us or calm us. So for those that have a hard time letting go or letting down or surrendering over that we're not going to get our way all the time, um, the emphasis of breath work for you might be on your exhalation, right? So it's like if I'm feeling unmotivated or I'm feeling sort of down or depressed or feeling like somewhat of a collapse, I'm going to focus my breath on the inhalation, right? To inhale is to take in life. It's like we excite, we activate the system, right? On days where I'm feeling super tense or super like fearful or anxious or I haven't had a lot of sleep, I will really focus on the down breath. I will really focus on bringing my exhale all the way down beneath my belly button so that I really can feel the letting go or the letting down of the energy. And so if you leave with anything around breath work, it would be one, if I don't breathe, I don't feel. So if I want to feel, even if I don't want to feel, but I know I need to breathe. If I'm not motivated or I'm feeling kind of down or I'm feeling sort of like a more of a collapsed energy, I'm going to focus on my inhale. I'm going to add more energy to the system. And if I feel tense and tight or anxious, and I'm having a hard time letting go or I'm forcing my energy, I'm going to focus more on my exhale so that the energy system can come down.
Yeah, that's super helpful.
Yeah.
I see everyone in the chat with your comments about holding breath or having that be a point of tension for you, where it's just constantly, like you said, in that preparing for a fight.
Yeah.
And you can't fully feel and process without the full breath. I see some folks are trying it right now
Oh,
and
good.
feeling how that feels. So I
Yeah.
encourage everyone throughout today and throughout your week to take some moments with that.
Yeah. As I always say about breath, it's free. You know,
Yeah,
right? You don't need insurance for it. You just breathe. You just breathe. And it's in some ways the kindest thing we can do for ourselves because um in our culture, um, we are so incentivized to move at a fast pace,
right.
and we are rewarded for that. And the breath becomes secondary, the body becomes secondary. If the body gets used in service of the achievement or the doing, and if we can slow down, we can recognize that the body is really sort of sacred and there to support us and support our mental health and well-being. And so we have to shift our own languaging and even understanding of our bodies in order to look to it as a resource to help us.
Absolutely. There's ways we can start to heal within ourselves. That's what this is all about, of taking these bodily practices and really allowing them to be a treatment plan for you.
Absolutely.
And so I love that that provides that. I love that you don't need insurance to breathe. You don't need health
No,
insurance,
not
but all of
yet.
these things, right? It's so true. There's these really just basic and core functions that we're holding our bodies back from,
Yes,
that they want to help us heal and
yes,
help us feel.
yes. And sometimes it's just even being aware of what our body is doing and seeing how it's either helping us or hindering us. So I can recall that when I first got into my own therapy, doing body psychotherapy as a client, I noticed that every time I would talk about something particularly vulnerable, I would look away from the
Yeah.
therapist. And the therapist said, "Do you know that every time you talk about this, you look away?" And I was like, "No, I didn't."
Yeah.
Right. And so she had me come back and talk about what I was talking about and stay in contact with her. And what I became aware of was this place that's like, no, this connection, this contact, this intimacy around this issue is too much. I need to leave.
Mm,
And so I was leaving through my eyes,
mm,
but I had
mm-hmm.
no awareness of that.
Yeah.
So I prided myself as someone who could come in and talk about anything in therapy, and I was going to work on it really hard, and I was going to whatever. But my body was saying something else.
Yeah.
My body was saying, I'm not ready to deal with this. I'm not ready to meet this head on. And so what's so valuable about understanding the body is that as a clinician is you're hearing what the client is saying, but you're also observing what their body is doing. And oftentimes it's very different,
Mm-hmm.
right?
Yeah.
So those very subtle observations of me looking away helped me understand there was something I wasn't wanting to look at, literally look at.
Yeah.
Right. So that's just another example of how if we can cultivate our own emotional body awareness and as practitioners cultivate the ability to observe someone else's sort of body reactions as almost part of the assessment, because you talked earlier about it being part of the treatment plan.
Mm-hmm.
It's also a way to understand and assess what's actually happening for us,
Yeah.
for the client.
Absolutely.
So that's a piece as well.
Yeah. Yeah.
One of the ways in which um, one of the exercises you can do is you just grab a piece of paper and a pen and draw your body in any way you can. I draw stick figures because that's the extent of my creative ability. And I start to mark on the body like where I've had chronic issues. I mark on the body where I feel a lot of pleasure. I mark on the body where I have zero relationship to that part of my body. Um, Places on my body I might sort of enjoy, and places in my body where I might not. And that mapping of the physical body can be really wonderful in terms of collecting information about your own experience. So I remember when I first did my drawing, there was a lot, as you can imagine, there was a lot of good stuff happening here. And then anything below the neck was sort of like, oh, well, I feel pain in my back. I always have cold feet. My hips don't really move at all. And in that assessment of drawing sort of my own experience of my own body, I was getting a lot of information about my relationship to the ground. My feet are cold. I was getting a sense of my relationship to my own sort of sexual energy. My hips weren't moving. I had pain in my back, which is a very kind of common for someone with a strong will or a lot of fear. And I had a lot of great energy up here where I feel safest. So that mapping is something you can do with yourself or your client to get, a better sense of what that person or what you are experiencing at a physical and sensory and emotional level.
Yeah.
So the breath work and the mapping can be a really good exercise. And then cultivating your own ability to become more conscious of your body and conscious of others as well. What do you observe when you're interacting with a client in their body and in their energy? And start to really build that capability and that capacity. One of the things I love most about the core energetics training is that so much of it happens when things aren't spoken, right? We interact at a verbal level, but the real stuff is happening beneath it.
Yeah.
It's happening energetically, it's happening emotionally, and it's happening physically. And it's happening spiritually. That's sort of what I believe. So, if we can get past the words and come into the senses and into the body, we can almost address issues far quicker. Not that it's a race, but in a deeper and more profound way sometimes than just the words can.
Yeah.
Right. So increasing observation of your own body and others, always with consent. We don't want to stare down a client. We don't want to objectify them in any way. We always want to ask permission if we are observing the body of like, is it okay if I, is it okay if I observe, or is it okay if I share with you that I notice that you look away when you're mentioning this? Like, it's really important to, particularly when we're talking about our physical bodies, that we ask for consent. Um, yeah, yeah. Any other questions that are coming up? I just want to make sure I'm
One
being
question
responsive.
I've seen from a few folks, just as we're talking about the breathing techniques and some of these different grounding exercises, is have you done work with individuals who have ADHD or neurodivergence and what that looks like for those folks, and kind of will it work the same, and what does that look like?
Yeah. So it's interesting. I have a diagnosis of NVLD, which is a nonverbal learning disability. And a component of NVLD is, well, twofold. One is a certain kind of disembodiment. There's like an aloofness that can happen, right? And also attention deficit is another piece of it. And I will say that grounding exercises have been one of the most helpful ways in which I can come out of that place of detachment or distraction. And even if for a minute or 2 minutes or 5 minutes, come into a place of focus. Now I have to keep going back to it because my brain is going to go exactly where how it wants to work or how it wants to function. But grounding and presencing and breath can be an incredible tool, not curative, but can be an incredible tool to just give the person an experience of that sensation of stillness or focus. It's very painful to feel, I mean, I also think obviously with ADD, there can be a hyper focus, right? And
Yeah.
so it's in that way, um, some of the more activating techniques could be really interesting to work with someone in that space, which we haven't really talked about some of the activating exercises or techniques that we do in core energetics or other somatic practices. But yeah, I would say that I don't know if the body-centered world has fully embraced or understands well enough how we can work with different diagnoses in terms of the body piece.
Mm-hmm.
But we're on our way. I mean,
Yeah.
there's a lot happening. Yeah.
Yeah,
Yeah.
definitely. Thank you
Yeah.
for that.
Thank you for that question.
I think we can keep moving along then. Thank you for that.
Yeah. So if you're open,
Yeah.
Jackie, you're going to be my
Yes.
um I want to show you some ways in which we can continue to assess and increase our own body awareness as it relates to the ways in which we may be using our body to block feeling or sensation. Okay, so I'm just going to have you stand, and I'm going to
Hmm.
stand with you. And I invite anyone who is um, open or willing or able to sort of get in either in a standing position or stay seated and just kind of tune into your body and follow along. Okay. So one of the first things we do in grounding, right, is to have someone either in a seated position or standing position, stand, close their eyes, and just begin to take a few deep breaths. And as you begin to come into a deeper breath, there's a way in which we can send our energy down into our legs and in our feet. And we can do that through our breath, through our exhalation, We can do that by visually imagining that we're sending our energy from the top of our body into our legs or our feet. And we can start to notice whether in doing that, we feel a little bit more contact with the ground. And what, if anything, shifts in us when we feel more contact with the ground. And so another exercise we can do is just as our feet feel safely planted, we can start to rock ourselves side to side. And this can have a real soothing effect, right? So if we're feeling anxious or we're feeling sort of uprooted, this swaying of side to side can feel, I mean, I know for me personally, like I just find it sort of, again, continues to bring the energy down, but it also feels just like I'm being rocked on in a boat, like I'm on the water. Right? And just notice as we do these exercises, what, if anything, shifts in you. Right? And so if you come back into a standing position, and you can place your hands on your hips. Now, this exercise is a little bit more activating. So this might be something we do if there's some low energy, or if we're exploring areas around this part of the body, so creativity and vitality and sexuality and a lot of things, right? And so one thing that we can do very, very gently and always inviting the client to decide if this is what they want to do is just begin to make some hip circles, right? They can go back, side, forward. And in some ways, this is really just about waking up the body, right? Adding some energy, some activating energy into the body. And we can energize that more, right? We can bring in a lot more of movement in the hips, or we can slow it down, right? And it really is dependent on what you or the client sort of is intending to do by moving this part of our body, right? What are we exploring? Okay. So the hips can be another place where we can engage. The next are the arms, right? So when we think of the arms and the hands, we think of sometimes the way we reach. And our arms are also a place where we might push away. Now, many of us may have feelings about asking for help, and many of us may have feelings about saying no and setting boundaries. And so our arms can be a really great way in a session for us to practice what it's like to reach out, right? And feel what it's like to say, I need, or I need help, right? Here I am. And so we might just stand face to face in a session and just see what it's like to have your arms out reaching, right? If we are not used to doing this, it may get tight really quick, or our arms may get fatigued. And that's a good sign that maybe this action of I need is really hard for us. And that's okay. That's just information, right? So at the same token, we might want to push away. And so we might sort of be in contact with our client and just have them push against us, right? Or have the sensation of like, you know, feeling what it's like to say no, right? Or feeling what it's like to say, I don't like that, right? So to give the person a physical sensation of an important expression, which is no, right? So our arms and hands can be a really powerful healing tool. Okay. The next thing is the jaw. So I have a very tight jaw, and partly it's because I hold a lot of have some ideas that anger isn't good or sadness is painful. And so I hold a lot in my jaw. So one of the exercises we do a lot in core is we really sort of accentuate the jaw. So you might open it really wide. You might stick out your tongue. You might growl, right? You might allow movement in this area to loosen the musculature in there that's holding a lot of feeling, right? So there's ways in which you can massage the larger muscles in the jaw, and then there's a way you can really activate it through sound, through grunting, through growling, through opening, right? Moving the jaw. That's another one. And the last one I'll offer is just through the eyes, right? So one exercise we do to ground in the eyes, which might sound like an odd concept because we think of grounding as contact with the floor. But grounding with the eyes is you just take your hands, can create some heat in your hands, and you simply just place them over your eyes. And you don't want to put any pressure on your eyes necessarily. You're just creating some heat and you're bringing them to your eye space. So that's a way in which we can, begin to engage sort of contact through the eyes. Another way you can do it, as we talked earlier, is about just holding some eye contact. So Jackie, I'm going to ask you to be my muse here, right? So I'm going to sit and I'm going to have you sit as well, if you're open to that. And to the extent that I'm trying to see where I'm looking and you're looking, like, can you see
Right.
you can see my eyes, right?
Yes. Yep.
Yeah. So I just want you to hold some contact for as long as you can. And if you're open to sharing, like, what, if anything, comes up for you in the contact? Like, what are you aware of?
I think as I look longer, I get more tightness in my chest.
Okay.
Um, and I'm someone that I've noticed, like you, in certain conversations, I like to break eye contact.
Yes. Great. So just in that small exercise, right, we're able to see that there's something in the contact that creates a tension that
Mm-hmm.
makes you want to go,
Yeah.
right? That's the lack of containment we were talking, not lack, but that's
Right.
the containment we're talking about, right? So in a session, we might sort of focus in on the tension in your chest and say, well, if that tension in the chest could speak, right? If it had a sound or if it had a word, like what would that be, right?
Yeah.
And then we can follow that, right? So it's like we can just think of our bodies as like a really important storyteller in
Mm-hmm.
the room that has a lot to say, right? And so part of the somatic practices we do in core energetics is to simply bring our awareness to those.
Yeah. Yeah, that's great. Even as we were kind of going through the different parts of the body and grounding through the feet, feeling the earth, I just felt my muscles relaxed when you said, what does it feel like when you're breathing down into your feet and feeling the earth? And all of a sudden I realized I was like clenching through half of my
Yes.
body.
Yes.
And
Yes. It's such a good
we
awareness.
tend
Like,
to hold our stress and our tension
yeah,
and not even if intentionally, but it's there until you really think about it and are
yes,
able to release and feel that grounding moment and kind of take an inventory of your
yeah,
body, where you're holding things, why you're holding
absolutely.
them, how to
Yes.
breathe through them.
And you're naming something so important, Jackie, which is like most of this is unconscious.
Yeah.
That's
Yeah.
why we bring the awareness of the body into the room so we can say, oh my God, I had no idea I wasn't breathing. I had no idea I looked away. I had no idea that the tension is so normal that I just thought that's how it is. I didn't know there could be something different than this.
Yeah.
And so it's bringing consciousness to the unconscious sort of um, tension, frozenness, wounding in the body, in the physical body.
Absolutely.
Yeah. So I'm aware of time, and I
Yeah.
think we had agreed that around this time we would just see if there's anything.
Yeah, absolutely. I've been going through and thank you all for all of your great questions. And comments. I see that people were following along, and a lot of comments about that uncomfort with eye contact and that being a really hard spot for
Yeah,
people. Um, a few different questions. I think we have a lot of kind of two groups of people who are joining us here today. Individuals who are looking to maybe incorporate this practice, and then some clinicians that either are practicing in this or want to incorporate it into their engagement with clients. And so, um, a few questions from those that are practicing clinicians is back to the eye contact and all of these things of will this create some real discomfort or triggering with clients, and how you kind of manage that or work through that. And I think that comes back to a part of why somatic practices are so important, because a lot of times we're not allowing ourselves to feel those
yeah,
emotions, and this does bring out both positive and negative emotions. And I've
yes,
even see those comments between those who are joining us just out of curiosity for themselves of like, that makes me feel really uncomfortable. Or I think
yeah,
if I did that, I would kind of go into a panic mode.
yes,
So, how do we work through to get to that place where this is getting past those feelings and
yeah.
emotions or
Well,
helping clients?
listen, like I think from a trauma perspective, like it is essential that we go slow.
Yeah.
It is essential that we titrate, right?
Hmm.
Because we don't want to send anyone into, we don't want to re-traumatize, and we don't want to send someone into so out of their window of tolerance, where they already are, that they can't or are afraid to come back. So
Hmm.
that going slow and feeling being informed around trauma is so essential. So that's one piece of it. And discomfort is part of being here,
Right.
right? And our ability to tolerate a certain level of discomfort, that where we know on some level we're safe enough to be able to experience it, is what we're also trying to create in the room.
Hmm.
Right. And so if you can only hold eye contact with me, Jackie, for 2 seconds, okay, that's 2 more seconds than we had a minute before.
Yeah.
Right.
Yeah.
And so and to be with the client, say, yeah, I hear this is uncomfortable. I know
Hmm.
this is uncomfortable. And if we can just stay in this for a second and trust that maybe by sitting in this, it violates a certain expectancy that we can't survive it, that maybe that's where some of the healing can come.
Hmm.
Right.
Hmm.
I mean, it's similar to CBT and exposure therapy of like you desensitize someone, but I think the difference with core is that this sounds strange, but we welcome the discomfort.
Yeah.
We recognize that it's an essential aspect of being able to not have to live in fear of that discomfort.
Exactly. And that fear is a discomfort in itself. If we're experiencing anxiety or some challenges, we're already discomfort. We're
Absolutely.
already uncomfortable. We're already
Yes.
in discomfort.
Yes.
So, it's how do we use that to process fully through those feelings to get to that other side. It came
Yes.
back to your full breath thing of, if we're not breathing deeply, we can't fully feel, and that's why we stay so much in here,
Yes.
is trying to process through thought and rationalize, instead of really allowing ourselves to not rationalize in here, but to fully feel that to be
Yes.
able to move through.
Yes.
Yeah.
Yes. And look, sometimes it's the opposite. Sometimes someone feels very overwhelmed by a lot of feeling and they have a hard time grounding in thought or grounding in
Hmm.
action. And so it can be, we talked about containment also as kind of just throwing off energy. And so we also want to support people who really need the support of kind of coming in and being able to just hold it and be
Yeah.
with it. Right. So yeah, there's a lot, we should be careful and considerate, but we also shouldn't be afraid that
Hmm.
we're going to make our clients uncomfortable. We're not
Right.
making them do anything, but
Yeah.
that we're all uncomfortable. It's uncomfortable. Uh,
Yeah.
yeah. And that to me is more the spiritual task, I think, of the work.
Absolutely.
Yeah.
Another question I'll bring up quickly here is just, um, have you worked with folks of all ages? Does this work with seniors and older folks? We had a question come in, or even with younger individuals, or what does that look like in practice?
Yeah. So I have a few colleagues who work with children.
Mm-hmm.
I'm not trained in working with children on a
Yeah.
somatic level, but I've worked with, I would say the youngest person I've worked with is probably like 18
Mm-hmm.
up to like 87,
Yeah. Yeah.
right? And what I say, as long as you're alive, like you got this, like there's life to live, right? And
Right.
so I think that we have to be careful about ego strength in
Mm-hmm.
any age group, but certainly younger people, and also just brain development.
Yeah.
What's the capacity? Having said that, like everyone's got a body, everyone's got to breathe. Most people have a real longing to like live fully.
Right.
A lot of people have obstacles in doing that, myself included, and we can support people in helping work through some of those obstacles to have a fuller experience. So no matter what age you're at, that's a possibility. I think it's about training, comfort level with that population, and what's appropriate for them.
Definitely.
Yeah.
Definitely. Yeah. Thank you.
Yeah.
I know we're right at the end of our time, and so I want to give a huge thank you to you, Amy, for joining
Sure.
us and being able to provide us with this information. We've had so many comments come in through the chat. I know you haven't been checking it out, but I'll share it with you afterwards of just all of the gratitude for you.
Oh,
And a lot of people that have been able to really process through this time together and take this moment. So thank you all for joining us. I know there have been some questions about, well, is this being recorded? Can we share this afterwards? Will we have access to this? Absolutely. So we will get the recording up within the next week and send that out to you all. That will also come with a link to our May resources and our certificate of attendance if you want to request one of those and you haven't yet. All of that will come to you in the next week. We really encourage you, if there's parts of this where you're sitting in your office today and you didn't want to try some of these practices we went through, watch the recording and try some at home and start to really incorporate these practices into your day to day and learn more. And maybe that looks like finding a practitioner who practices in somatic healing that you can start to work with, or as clinicians, you can start to incorporate some of these things into your practice with clients. So
yeah.
just thank you all for being here. And again, thank you, Amy.
Oh, my pleasure. Thank you. Thanks everyone for being here, and thanks Jackie for this.
Yes. All
Yeah.
right. Well, everyone have a great rest of your afternoon. Again, happy Mental Health Awareness Month. We hope that you continue to engage in activities like this, have conversations, take some time for yourself to really practice. And we will be in touch soon with the recording and all of the materials. But thank you.